Well, I have not apologized because I think that all of us, when we were advocating for this legislation, we said time and time again that we get rid of discrimination against people with pre-existing conditions. We wanted to get rid of people having their policies canceled as soon as they got sick. We wanted to get rid of these annual limits, these lifetime limits, and all of us knew full well that all of our constituents were made aware of what's in the policies would determine that time whether they like what they wanted. And once they become aware, and if they like it, then keep it. But when they become aware of what they did not have, I don't think there's anything for us to apologize for. What we're doing is pressing issues that most people, and I'm one of them. I mean, I have 3 daughters. My first 2 I ended up paying for out of my pocket because I did not read the fine print. And I had changed jobs in the middle of my wife's pregnancies, and they would not pay. Though both my jobs were state jobs, they had a little thing in the fine print that says when you change jobs, you have to be on the new job 10 months before we would pay for what you call it, maternity leave, maternity care. And I ended up paying for it. So just having a college degree ain't going to help you much.
Can I just add, I've got a district that is extremely working class. Average income in my district is probably in the low 30s. In a place like Los Angeles, that doesn't take you very far. If you look at the census data, you'll find that folks in my district probably hold down more jobs, work longer hours than most people in America. They have to because they don't earn very much. Most of these folks are, unfortunately, among the uninsured. In fact, my congressional district of the 435 congressional districts in the nation is the second most uninsured when it comes to health care in the nation. So what do I hear from folks back home? I'm getting lots of thank yous, lots of thank yous. And as I mentioned, Andrew Stryker waited 3 hours to get his policy, but he's going to save $6,000 now. Same or better health care coverage, $6,000 extra dollars in his pocket. I think all of us are hoping that that's the story of this new health security law. We've got to get past the glitches, and the administration has heard it from us any number of times, and they've said it themselves. We did not want to see these glitches, these bumps in the road with the website. But the important thing is not to repeal it because you had some glitches, is to continue to improve it so you can have more stories about Andrew Stryker getting great health insurance and saving $6,000. I think everyone wants to.
I just wanted to say, first of all, you understand that if you had a policy on the day that this bill was adopted, you got to keep it. Now, you didn't get to keep it if the insurance companies didn't want to offer it to you. We didn't say the insurance companies had to give you the policy. We said if you like it, you can keep it. But nobody had in mind that the insurance companies were going to be forced to offer people insurance. They're not forced to offer people insurance right now. And so that the statement, if it was limited to the bill itself, was absolutely accurate. Now, the problem is people interpreted that, and frankly, we said it expansively. And as you may have heard me say in my press conference, we weren't as precise as we needed to be on that issue. Now, what the President has done is said, look, we made that representation. We're going to try to keep that for the next year so that you can have some time to figure out what is in your best interest and your family's best interest. But as it related to the time that was being made when we were presenting, that statement was accurate. After the bill, of course, the bill said you could have your policy, but at the end of this year, it had to comply with the requirements of the Affordable Care Act. Why? So that we would, in fact, share the risk and not have somebody have a policy that was of such low incidence of payment for health care that it would be passed along to the rest of us. That's the premise of insurance. You want to share the risk.
The President was very gracious in taking responsibility and making an apology. But I agree with Mr. Hoyer. What the President said in regard to the Affordable Care Act is absolutely so. There is nothing in the Affordable Care Act that said that your insurance company should cancel you. That's not what the Affordable Care Act is about. It simply didn't happen. Did I ever tell my constituents that if they liked their plan, they could keep it? I would have if I had ever met anybody who liked his or her plan. But that was not my experience. That was not my experience, and it was not my experience. As a mother of 5, occasionally has a bad back and the rest of that, I was considered a poor risk, even though I had some resources and thought I was quite strong for having 5 children. But the insurance company didn't see it that way. So I didn't run into many people who say, I love my health insurance policy. And if it is that they do because it's such a low premium and high deductible, predicated on no incident of accident, illness, diagnosis, or anything within their own family, you know that something is down the road for them. And the fact of insurance is to spread the risk for those families as well. So as far as the Affordable Care Act is concerned, what the President said was completely accurate. I commend him for his graciousness for taking responsibility.
I just want to make a comment because I know exactly what the leader meant. But let me tell you, when members said that, there's nothing in this that mandates that any large corporation, which insures most people in America, would stop their policies. Nothing, zero, nada. And it was our expectation and hope that if General Motors or Microsoft or General Electric or whoever you work for had an insurance policy, there's nothing in this bill which says they need to cancel it or stop it, period. And they're the overwhelming number of insured in this country, and that's certainly what all of us expected, because I had some people come up to me who did like their policy, who were working for a corporation or a large, medium, or small that was giving them a good policy, and they liked it. And I was absolutely accurate and said nothing in the bill is going to take this policy away from you, and that is accurate. It was accurate, and it is accurate.